have dedicated my career to ensuring that the University of Manitoba graduates high-quality health professionals for Manitobans. The University of Manitoba is the only post-secondary institution in our province that graduates dentists, dental hygienists, physicians, physician assistants, midwives, occupational therapists, pharmacists, physiotherapists, and respiratory therapists, in addition to having the largest nursing program. Therefore, the healthcare of Manitobans depends on our faculty members' ability to provide quality education, mentoring, and training. Exceptional healthcare begins with exceptionally trained healthcare providers. Consider this. When your mother shows signs of dementia, or your child is struggling with anxiety, your partner has a stroke, who will you need to rely on? And you will want to rely on the best. The last few years have shown us that we need highly skilled instructors who can adapt quickly to our changing world. This adaptability is not only needed for the landscape of today, but for healthcare of the future. COVID-19 brought light to the expertise and innovation required of the University of Manitoba instructors. When the pandemic happened, we were there, adapting to online teaching and finding ways to ensure that our students still developed the hands-on skills that they would need to provide quality patient care. When the world locked down, we were still there, ensuring that we still graduated competent providers. Providers who will be there to reduce disability and mortality from this pandemic. My colleagues and I are committed to our students. We're committed to integrating the best evidence. We're committed to reducing health inequities. We're committed to contributing to a healthcare system that we can be proud to pass on to our children. But we can't keep doing this work the way we are. Recruitment and retention issues are real for us. I have seen amazing people get hired, only to have them scooped up by another university. Vacancies are real. Many of our departments never experience having their full complements of staff, and this means that the work just gets spread on those of us who are there. Therefore, we refuse to compromise on the education and research foundation of your future healthcare providers. We stand before you today and ask that you stand with us in demanding that this conservative government stop trying to force us to compromise your healthcare. Thank you.
Now, as part of our union, the University of Manitoba Faculty Association, we have professors like Linda, instructors like Lisa, and we have librarians like Carol. Welcome, Carol.
Good afternoon, everyone. My name is Carol Cooke, and I am a librarian. More specifically, and perhaps more intelligently right now, I am a health sciences librarian. And what that means at the University of Manitoba, where I've been now for 27 years, is that it's my responsibility to help and support those in the Rady Faculty of Health Sciences. During the early part of the pandemic, librarians like myself helped students pivot their research to supporting the COVID fight. We gathered the most current information we could find for students to write a weekly report. That weekly report was given out to healthcare providers and public health officials, both here at home and internationally. This work allowed the province to make decisions based on the best available evidence at a time when it was most critical. There are millions of books, articles, and journals on health. What we as librarians do is teach students information literacy and how to find what they need to succeed and to graduate. And trust me, you want our healthcare professional students to graduate. And you want them to graduate now. After graduation, you're not done with us as health sciences librarians. And I would like to point out that all the health sciences librarians in the province of Manitoba are largely employed at the University of Manitoba. So if we're on strike, you have a serious problem. So after graduation, we also help frontline doctors, nurses, and you guys rock, dentists, pharmacists, occupational, physical, and respiratory therapists, which were absolutely critically needed during this pandemic. We help them to find what they need to keep you, Manitobans, healthy. This essential work gets harder and harder to do as we lose the staffing to do it. And Orby, you're intimately familiar with this particular issue. This year, the Health Sciences Library lost 4, count them 4 librarians. 1 to retirement, which we kind of expected, and 3 to continuing appointments. Yeah, it makes it very difficult to provide healthcare services and health workers the information that they need to make those decisions for your health. We're at a critical point where our university is really no longer competitive. We have problems hiring new people because we can't offer them a competitive salary. We have problems keeping people because they're given better offers at almost all other universities in our country. That's ridiculous. We can't hire and keep faculty, and ultimately, the health of Manitobans suffers. Manitobans need a healthy and competitive university. I call on Heather Stephenson and the PC government to withdraw the mandate and on our employer to bargain freely and fairly for a fair deal for UMPA members. Thank you.
Thank you, Carol. So we're a big community of professors, instructors, librarians, students, graduate students, undergraduate students, nursing students. We also do some research over at the University of Manitoba. Take it away, Sachin.
Hello, my name is Sachin Katyal, and I'm a cancer researcher and associate professor at the University of Manitoba. Many have asked, how do University of Manitoba faculty and health researchers improve the well-being of Manitobans? It's a fair question. And as we gather here today to focus on health, I want to explain and hopefully convince you why more than ever we need to continue supporting UMPA Health Sciences members in research, innovation, health delivery, and health policy. Now you may not know, but the U of M is an economic driver of the province. For every $1 invested into this university, Manitobans get back $1.50 return on investment. That's economic activity, job creation, savings, and innovation. Now researchers, we garner hundreds of millions of dollars in national and international grant dollars in revenue. For example, my colleagues in community health sciences have brought into Manitoba over $325 million in the past 5 years in grants and contract funding, spanning all facets of health research, delivery, and policy, including neonatal, child and maternal health, COVID-19 research, cancer, aging, and Indigenous health. Biomedical scientists, the lab rats, who lead bench-to-bedside discoveries in clinical trials in cancer, diabetes, genetic diseases, immunology, infectious diseases. We've brought in $120 million in grant funding dollars into Manitoba over the past decade. Not to mention tens of millions of dollars of more dollars in new state-of-the-art research infrastructure and machinery here in Manitoba. This money doesn't go to us to fund our salaries. Okay, it doesn't go to fund researchers. We don't take anything off the top. No. Okay, this money is solely dedicated to fund research projects in all facets of basic, clinical, and applied health sciences and innovations to develop and benefit Manitobans and Canadians. This money is used to employ skilled bachelor's, master's, and PhD level workers, and train our next generation of scientists and medical professionals to keep our skilled workforce growing, our province prospering, all to serve you, the Manitoban community. It was UMFA faculty who helped develop the new Ebola vaccine. We were the ones who led the way in new HIV treatments. We were the first to bring the gamma knife to Canada to treat brain tumors and brain damage in less invasive ways. But there's more to what we do. Our UMFA colleagues in nursing, rehab sciences, pharmacy, dentistry, and medicine are all involved in advocacy, consultation, health policy development, and health delivery at all levels of government, nonprofit agencies, and out in the community, be it businesses, the school system, or community-based organizations working with Indigenous and marginalized peoples. When the PC government, under the failed leadership of Brian Palliser as Premier, and supported by Heather Stephenson as Deputy Premier, gutted, and I mean gutted, our healthcare system. It was these UMFA-membered professionals who pushed back, who went to bat and fought for Manitobans' health. Medical education, development, and innovation are the pillars of healthcare. Our teaching colleagues in K-12 education ingrain curiosity and provide that initial learning. However, it is at the university, that these medical professionals expand their critical learning. Undergraduate teaching instilled by UMFA members provides the background and prerequisites whereby students move on to professional programs. UMFA faculty teaches in all programs and courses in medicine, nursing, dentistry, rehab med, pharmacy, and biomedical research. They provide these future health professionals with the skills needed to keep the Manitoban health system functioning, growing, moving, and most importantly, replenished. We hear about critical doctor, nursing, and rehab shortages. Well, without UMFA health faculty training this new generation, we will never be able to fill this critical shortage. Now more than ever is the time to invest in UMFA faculty, educators, and researchers. Otherwise, this shortage will become even more dire. We've already heard about how our fellow Manitobans have been shipped out of province due to critical health staffing issues. And the way we're going, this will become the norm, not the exception. And so I come here today to tell you that the future of Manitoba, our future, is in trouble. We are at a tipping point. There's mass discontent as UMFA members are one of the lowest paid faculty amongst all Canadian universities. Right now, as we speak, about 1/6 of our faculty, that's 200 members, are actively looking for new positions outside of Manitoba because every single other Canadian province has universities that will offer these health researchers, educators, and innovators more money and opportunities to conduct their work. This is all because the Heather Stephenson, Brian Palliser PC government continues to make Manitoba an unsuitable place to work, teach, conduct, and grow a research program. In fact, these past years alone, we have lost innovative researchers studying brain diseases, ovarian cancer drug delivery, and blood cancer treatment. Similarly, we've seen nursing faculty retire and move away to other institutions. We cannot replace this lost talent because professionals refuse to come to this province when they can find better supports and salaries elsewhere in the country. Let's face the truth. We are hemorrhaging skilled talent, healthcare educators, professionals, and innovators. This is a major crisis, a continuous brain drain from Manitoba, and the implications are vast and will have a domino effect for the future health of Manitobans. Now, when the pandemic hit, it was the University of Manitoba UMFA faculty who answered the bell. UMFA membered and university-affiliated biomedical researchers, clinicians, and educators in nursing and rehab brought in over $80 million in new money to study, understand, treat, and prevent COVID-19 for the benefit of Manitobans. We ran one-of-a-kind clinical trials that identified new ways to treat COVID-19, and and others that did not work. We developed cutting-edge ways to study COVID-19 variants of concern and how the virus is able to transmit and attack the body. But more importantly, it was university members and affiliates who came together during both the second and third wave when the Palliser-Stephenson PC government acted irresponsibly, played politics, and cost over 1,200 Manitobans their lives. It was hundreds of these researchers, scientists, health policy experts, doctors, nurses, rehab professionals, and other medical scientists who signed their names on these letters. Okay? Both in November last year and May this year to force Brian Palliser and Heather Stephenson to use science and not politics to alter our pandemic response and protect Manitobans. We helped to force the Stephenson-Palliser PC government to let those who we respect and admire and look for guidance, Drs. Brent Rusin, Josh Reimer, and Ms. Lynette Saragusa, to finally take the reins and lead us out of the PC government-induced mess. It was these efforts of UMFA members on your behalf why we can now meet your friends and relatives at home, at community centers, go back to small businesses and restaurants, or go watch the Jets or Bombers live, or simply go watch your kids' hockey games. Manitoba is already losing. We're losing our talent, our healthcare system, our innovations, our future. If we truly want to build back our healthcare system, provide research innovations to Manitobans, and restore healthcare delivery in this province, we need to make this province competitive to keep whatever experts we have left, recruit others, and train new ones. I want to leave you with this. Dr. Brent Rusin, educated by UMFA faculty, BSc class in 1996, MD class of 2000, law class of 2009. Dr. Josh Reimer, educated by UMFA faculty, MD class of 08, Masters in Public Health 2013. And finally, Ms. Lynette Saragusa, Bachelor's of Nursing, class of 95, Masters in Nursing, class of 2008, educated by UMFA faculty. These are the hero Manitobans UMFA members have trained. Premier Stephenson, I urge you to stop following the failed Palliser policies of your party. Step out of Palliser's shadow. Show your independence, your leadership, end the UMFA wage mandate, and stop interfering in University of Manitoba affairs. Thank you very much.